Good evening, everyone. Thank you for joining us for our February 15th COVID-19 update. It is good to be with you all virtually, and I am joined again today with our public health and public safety experts from the city. We have Ted Jankowski, our Director of Public Safety. We have Jody Bishop-Pullen, our Director of Health, and we have Dr. Yoon from Stanford Hospital with us today. And we're going to be providing updates on where we are with COVID-19, mitigation recommendations we're continuing to encourage the community to follow, as well as updates on an executive order related to mask mandates and where we are in terms of mask protocols as a city. So starting with the mayor's update, I'll just give a couple of updates on where we are in terms of this pandemic. Good news is we're in a much better place than we were a month and a half ago. And really, we're starting to enter into a new phase of the pandemic. This is largely due to the incredible cooperation of the public. I want to thank everyone for being so devoted to our community, to doing what's right, to doing your part, to wear your mask, to watch your distance, to wash your hands, following all those guidelines that we've been reiterating. Most importantly, also getting vaccinated and getting boosted. We're one of the most vaccinated cities in the state and really want to credit our community with stepping up and doing their part so we can be at the place where we are now, where we're starting to see a significant decline in COVID cases, which I'll touch on in a few minutes on our next slide. So thank you to the public. And of course, thank you to our first responders, our healthcare workers, and everyone who's been on the front lines for over 2 years now, working to keep our community safe. We are so grateful for the sacrifices that you've made to protect our community during this difficult time. So update on the mask mandate. You'll remember on December 21st, I put back in place the mask mandate based on the guidance and recommendations from the CDC, as well as our local health experts, and due to the increase in case numbers we were seeing. At that point, we were seeing cases double by the week and hospitalizations double by the week, and we were seeing an increase in the highly contagious Omicron variant. Fortunately, now we've seen a significant decline in our case rate, in our daily positivity rate, as well as a decline in our hospitalizations. And I said, and we all said that we would be back here mid-February to reevaluate where we were. And fortunately, again, thank you to the cooperation of the public. Thank you to the cooperation of our small businesses. There were no fines or warnings that had to be issued over the past several weeks because of the incredible cooperation of our community. And because of this, we are now fortunately in a place where we can lift the mask mandate requirement. So effective midnight tonight, that citywide requirement will be lifted. And starting tomorrow, you will be able to not wear your mask. However, please pay attention. Some businesses will still be requiring it and will be able to implement their own policies. So please just pay attention to signage and guidelines. If you're going to your local gym or the grocery store, pay attention to the signage because businesses may have their own requirements. But the citywide mandate is lifted. Of course, if you're coming into government-run buildings, there is still that mandate because of the fact that we as government officials and first responders have to make sure that our community is safe and that we're running our government. We do still have that requirement in place in government buildings. Any questions about the mask mandate, feel free to reach out to our office at mayor's office at stanfordct.gov if you have any questions. I also want to note that on the school mask mandate, I know we've been getting a lot of questions from parents, teachers, and students. And again, we want to thank our community for their patience with this. We know it's been a really difficult 2 years. And that people are tired of wearing masks, but we appreciate everyone's cooperation with this. And we do feel that we are very close to getting to a decision point on being able to lift the mask requirement in schools, although we're still listening to our public health experts, working closely with our superintendent. She is the one that has the authority to lift the requirement in schools. And we're waiting on, as soon as the governor lifts the mandate on February 28th, you'll be hearing more very soon on where Stanford schools will go, but we anticipate that it will be lifted very soon. So please, pay attention to the Board of Ed meeting tonight. The superintendent will be putting out guidance. And again, if you have any questions, you can direct it to our office or the superintendent's office. I also want to give an update on where we are on before that, I want to just obviously remind everyone to get vaccinated, get boosted, and to continue to be vigilant. While we are in a much better place, We still know that the variant is out there, and the best way to protect yourself and your family is to get vaccinated, to get boosted. We still know that's the best way to reduce your chance of having severe symptoms and the need to be hospitalized. So please continue to do your part to get vaccinated and get boosted. Here's a list of testing sites and vaccination sites. Jody will be touching in more details on these later in this presentation, and you can always go to stanfordct.gov to find out more information about when these are open and where you can get vaccinated or get tested. In terms of our numbers, and again, I'm really excited to share the positive numbers that we're seeing and the significant decline that we've seen due to the mitigation measures that we've put in place. So our 7-day positivity rate is now down to 6.3%, down from 38%, which it was at a month ago. In terms of our cases per 100,000 residents, we are now down to 16.8 cases per 100,000 residents for a 7-day average, down from 334 cases per 100,000 a month ago. So you'll see here, continuing, we saw a big spike obviously in December and January, and now seeing a significant decline. So really pleased to see where we are now. And again, want to thank the public for their cooperation and our public health officials for all that they've done to get to this point. And similarly, we're seeing a significant decline in hospitalizations. A month and a half ago, we were seeing them double and even triple by the week. We had a high of 504 hospitalizations in January. This was for Fairfield County overall. Now we're down to 81 hospitalizations in Fairfield County, and we're continuing to see a significant decline in hospitalizations at Stanford Hospital specifically, which Dr. Yoon will touch on more closely. So again, I just want to thank the community for doing your part, for hanging in there, for everyone working together to get to where we are now. I'm so proud of the Stanford community for what you've done together to keep our community safe. But please remember to still be vigilant, that we are still recommending that individuals wear masks indoors in certain circumstances. Obviously, if you're not feeling well, if you've been exposed to COVID, so please continue to follow the CDC guidance. And then also do your part to get vaccinated, get boosted. And hopefully we're going to continue to be coming out of this pandemic and entering into this new phase. And especially with warmer weather coming, we're really optimistic for the spring and summer ahead. So with that, I'm going to turn it over to Dr. Yoon, who's going to give some more specific updates on the numbers.
Thank you, Mayor. Let me pull up some slides. Can you see my slides?
Yes.
Fantastic. So thank you, Mayor Simmons. I'd like to give an update on a few things. Most recently, a CDC recommendation, as well as some recent data that was provided with help from Dr. Asha Shah, who's the Director of Infectious Diseases at Stanford Health, that often gives this information. So, great. So this is just some statistics on national trends that we're seeing, very much mirroring what we're seeing here locally. You can see the spike that's happened most recently. This information is from the New York Times. On the chart in the upper right-hand corner, I think what's really important to notice here is that 14-day change, that second column, just continues to show significant decreases over time, which is great. And the bottom diagram is the heat map showing where the hotspots are throughout the country. So as you can see, COVID continues to be a significant issue throughout the United States, and you can see exactly where they seem to be focused. This next slide has to do with Connecticut trends, COVID-19 trends, very similar to the ones that, Mayor, that you had shown as well. The reported cases, big spike starting in early December, mid-December, January, and has come down significantly. Again, in the upper right-hand corner, you'll see the 14-day changes even locally reflect that significant reduction in cases, tests, hospitalizations, ICUs, and deaths, which is very important. And then in the lower right-hand corner, I thought this was a very interesting graph. What it shows is that the blue color are the number of fully vaccinated patients in the hospital as of today throughout the state of Connecticut. And you'll see that most, the vast majority of COVID positive inpatients are either not vaccinated, not boosted, or partially vaccinated. So I think that's very telling in that those that have, that are in the hospital that have COVID are mostly those that have not been vaccinated. We know that there are breakthrough cases, and that's reflected in this graph as well. But the vast majority of them are not vaccinated, not boosted, or only partially vaccinated, which I think really reinforces what we've been talking about in terms of the importance and the value of getting vaccinated. This is data from Stanford Hospital Laboratory, which is a little different from, Mayor, what you presented earlier. This is all the tests that come through the Stanford Hospital lab. So it really encompasses more regionally here in this general area, but the message is the same. We're seeing a decrease from last week of a positivity rate of 5.95% to less than 4.88%. These are all trends that are looking very favorable across the board, and hopefully will continue to do so. So let's review. I know that everyone's probably sick and tired of hearing me say these things, but I think they're really, really important mitigation strategies that we've been working with from the very, very beginning. Social distancing is a big component of mitigation to reduce risk. Wearing masks. We've heard it time and time again that masks work, and that's a way to keep the spread of COVID down. Washing your hands is another mitigation strategy that we've been talking about regularly, not only for COVID, but other respiratory illnesses. And finally, the COVID vaccine, where everyone has heard that the vaccine, which is safe and effective, is one of the major mitigation strategies that was most recently added to this sort of toolbox or armamentarium of strategies that we're using to reduce the risk. This particular slide talks a little bit about, on a big picture level, tells us that boosters work. If you look at the left graph, the solid line on top is the number of cases of those people who are unvaccinated between April and December of this past year. And you can see that as the cases continue to rise, the unvaccinated are quite significant. If you look at the rest of the lines below that, which are fully vaccinated without boosters and with boosters, you can clearly see that those that have been vaccinated have significantly lower case rates than those that haven't. And that translates again to the number of deaths. So if you look here on the right graph, you'll see that that is the death rate of those people who are unvaccinated during that same time period. And way down at the bottom, you'll see those deaths from those who are vaccinated or at least partially vaccinated. So take-home message here is that the vaccines work. The vaccines work to prevent the spread of the disease, hospitalizations, and ultimately deaths. So where do we lie in terms of our vaccination rates here in the state of Connecticut? I know it's a very busy slide. The take-home messages here are really that if you look at those that have been partially vaccinated or fully vaccinated, it's mostly in the older populations, which makes sense. Those were the populations that we were really focused on from the very beginning. And so they are the most vaccinated at this point. As we get lower, the vaccination rates go down, but they're still pretty good. If you look at 12 to 15, almost 80% of the population has gotten at least one dose, and 70% have been fully vaccinated. Obviously, less than 5 has not yet been approved, but we anticipate that coming hopefully within the next couple of months. If you go to the far right, though, that's our booster rate. And unfortunately, we're not doing nearly as well as we would like to see in terms of our population getting that booster dose. So at the very bottom, you'll see at least 83%, about 84% of the population in Connecticut has gotten at least one dose. 74% has been fully vaccinated. But you'll see here that only about 37% of the population has received their booster dose. And so that's where I think we really need to be focusing our efforts to get people vaccinated so that they can gain the benefits that we showed in previous slides in terms of reduction of spreading of the disease, hospitalizations, and deaths. So just yesterday, the CDC put out a reminder to those of us that we should get tested soon and treat early, which is a little different message than, which has been an evolving message over time. Whereas earlier, the focus was on mitigation strategies. Now we're also trying to put some emphasis on testing soon and treating early. And that's because resources are now available that weren't as readily available earlier when it came to testing and treating. So your healthcare provider will make recommendations. And we look at those that become positive, and we do risk assessments of those patients as well. And so there are populations of patients that are at higher risk for progressing to hospitalization and death. And so there's a list that the CDC puts together that your healthcare provider should be familiar with as well, that suggests that we probably should be a little bit more aggressive when it comes to making sure that we monitor for progression and treatment. And then, of course, the treatments that are available in terms of medications really should be prescribed by a healthcare provider. Those drugs that have been approved and authorized for use have gone through a rigorous vetting process through the FDA, the U.S. Food and Drug Administration, in terms of their safety and efficacy. And that's in addition to the treatment guidelines that have been developed through the National Institutes of Health to really look at best practices in terms of how best that clinicians use these medications and these treatment regimens for those that are positive. Now, there are some, unfortunately, that may progress despite our best efforts and end up in the hospital. And so there are treatments in the hospital that are very different from what we started with 2 years ago when the pandemic first started. We have medications, antiviral medications, and other treatments that slow the virus, so it doesn't necessarily spread as much. We've also learned over time that the body reacts to the virus in a number of different ways, including inflammatory processes, or where the body's immune system really gets ramped up to try to overcome the virus. But sometimes that process can cause some damage as well. So in the hospital, we use many treatment measures to reduce overactive immune responses so that it does what it needs to do, but doesn't necessarily do damage that we don't want it to do. And then, of course, there's treat complications, because sometimes that may present itself as well, whether it's damage to other organs because of this inflammatory process. But being in the hospital allows us to treat many of those complications in ways that we couldn't necessarily do as an outpatient. Having said that, treatment outside the hospital is really what we're targeting at this point. We don't want people in the hospital. We want to, as the CDC had mentioned early, this idea of identifying, testing, and treating early. So your healthcare provider might recommend the following to relieve symptoms and really support your body's natural defenses. Things like helping reduce fever, keeping well hydrated with fluids, getting plenty of rest. Those are things that are very important for any infection. However, there may require additional treatment measures, and your healthcare provider might recommend these additional treatment measures as well. These are treatments, these are medications that were not available early on in the pandemic and that are now available, but many of them have a small window of opportunity. So it becomes very important to try to identify these cases early and connect with your healthcare provider so that they can provide you guidance, especially those that are at higher risk. So for example, Stanford Hospital, for almost a month now, has created an outpatient COVID-19 treatment center. Excuse me. And what they've done there is it's by referral from a healthcare provider, from your healthcare provider. And what happens is they use treatment options for patients that are reviewed based on the most current treatment guidelines from, for example, the NIH they had mentioned earlier. Because what they want to be able to do is they want to be able to match the treatments with the patients and the patient's conditions. Because there are different treatments that have different eligibility requirements, some of which include age, medical conditions, and pregnancy. So as I had mentioned before, most of them have a window of time to initiate treatment. Many of them a very short window of time, anywhere between 5 to 10 days. So I want to really emphasize that getting tested early, identifying and reaching out to your healthcare provider is that much more important, because not only will it help reduce the spread of the disease, but it'll help those, especially those that are at higher risk, to get the treatment if they're eligible for that. And for those who don't have a healthcare provider, that haven't already established with a healthcare provider, please contact your insurance company to get the names and contact information for a local healthcare provider. There are also local FQHCs, Federal Qualified Health Centers, or the Department of Health can help, regardless of your insurance status or immigration status. So please reach out to us as well if you need help getting connected with a healthcare provider, so that we can get you treated as quickly as possible, as safely as possible, for the best outcomes. Thank you.
Thank you, Dr. Yoon, for that excellent presentation and for all your work and leadership at Stanford Health. So next, I will turn it over to Jody, our Director of Health for the City of Stamford.
Shall I share my screen?
Yes, absolutely. And Jody, I'm happy to pull it up too if.
Okay. Let me just get it. I just lost the screen. So if you want to go ahead and pull it up, that would probably be.
Yes.
There we go. Okay. Okay. All right. So I will just build a little bit on what the mayor and Dr. Yoon talked about today. Mayor, I think you have to advance this then. Okay. So as they both mentioned, that vaccines are our best methodology to prevent COVID. It's always been a public health tool that we've had to fight infectious disease. And then, we are fortunate that the vaccines are available for COVID. They are safe and effective. The immunity rises greatly when you receive your booster. And Dr. Yoon went into that a little bit about the difference in hospitalizations and death when you've had your booster. So we really encourage people to come out and get their booster. If you're past the time when you had your second dose and you're in most cases 5 months after, you can receive a booster. And that will just really increase the effectiveness of the vaccine. And we want to remind everyone that you do not need insurance or immigration status, and all of our clinics offer the booster. Okay, go to the next slide. We do have these very accessible and comfortable vaccine sites in Stamford. We try to be all over the city so that wherever you live, wherever you work, you can have access to a site. We try to make the hours so that they are also, lots of available times. They are offered by all professional, trained healthcare providers, and they're, just very comfortable. Scalzi and Cummings Park, they start early in the morning and a little later in the afternoon. The one at Hunt Park starts a little later and ends a little later. At the Stanford train station, adults can get a vaccine on Tuesdays and Thursdays in the afternoon, early evening. And then we have the community clinic that the health department runs at 137 Henry Street, and that's open Monday through Thursday, 8:30 to 7, Fridays 8:30 to 3, and then on Saturdays, we just opened on Saturdays at the Henry Street location because it's a very popular time for people to get vaccinated. So that's something new. You can go to the next one. We also have a new site, fairly new site at Westover School, also on Saturdays. All ages can go, so family can go, the adults can get their booster, and children can get their vaccine. It's really important that children are getting their vaccines. You did notice from Dr. Yoon's slide that in Connecticut, the rate of vaccination for children ages 5 to 11 is significantly lower than our other age groups, and Stanford does mirror that. That's very similar for Stanford. So we are encouraging the families to bring out your children and get vaccinated, and we have this very convenient, safe location at the school on Saturdays, 10 to 4. Okay. And then, as Dr. Yoon suggested, testing is another strategy that we can use so that we know early on that we are sick, that we can stay home, stay away from others as soon as possible, but also if we are eligible to get treatment, that can also be started right away. We have testing sites that do the PCR testing in Stamford at St. Mary's Church on Elm Street. That's a state supported testing site, and that's open Monday through Friday 2 to 7 and weekends 10 to 3, trying to accommodate people's needs and make sure you have that time available when you can get there. Fairway 689 Canal Street. This is the old Fairway shopping site that is now being used for testing by a company called AccuReference. Again, they have very accessible hours during the week, 8 to 7, and weekends 9 to 3. And both of these are walk-in, but you can also make an appointment. So whatever fits your needs, you can do both. And then our other private partners at the pharmacies, urgent cares, and Stanford Health has testing as well, as they also offer vaccines at Stanford Hospital, which is Stanford Health. So there is a lot of availability throughout the city, and we're encouraging you to take advantage of these mitigation strategies. Okay. So, Dr. Yoon talked about the typical mitigation strategies that we've been using and encouraging everyone to do all this time, which is distancing and masking and hand hygiene. We have some other things that we are encouraging people to pay attention to and make choices. I know in my family, we talk about things like this all the time when we're making decisions about what activities we might want to participate in. So you want to pay attention to your symptoms. If you feel sick, stay home. Dr. Yoon and one of our other doctors from the hospital used to say, when in doubt, sit it out. So you don't want to risk getting others sick when you're not feeling well. So that's one thing. When you're going to gatherings, fewer people is better than having a lot of people. You're less likely to be at risk when there's fewer people. Masking in situations where the vaccination status of others is unknown. So that's a good thing to pay attention to. Wait to travel until you're fully vaccinated and boosted. That's really the ideal time. And then testing before you travel and after you travel to make sure you're keeping others and yourself safe. You can also test before gatherings, or of course, when you have symptoms, as we talked about earlier. When it's possible, stay outside. We're all looking forward to the spring when we can be outside more. That is the safer choice. And inside when there's good ventilation, being able to open windows. Those are things that keep us at a lower risk for getting the disease. So we just wanted to offer you some suggestions for keeping you and your family safe. Continuing to help our community, as the mayor has talked about, and thanking everyone for doing your part to keep Stanford safe and healthy. Okay.
Thank you so much, Jody, for that wonderful presentation and for all of your work and leadership, keeping our city safe, and for all the work on expanding our vaccination and testing sites. There's been an incredible amount of work on that over the past several months and several weeks, which really has led to the great position that we're in now as a city. So thank you, Jody. Thank you again, Dr. Yoon. Thank you, Ted, for all of your efforts. And with that, I'll just close by again thanking our community in Stanford. I'm so proud of where we are as a city, and while we still need to remain vigilant, I think it's pretty incredible what we've overcome these past 2 years, and that we're in such a good place now. But please remember to be cautious. Wearing masks is still recommended indoors in certain circumstances. We're still encouraging everyone to get vaccinated, get boosted, get tested, and to be vigilant so that we can continue to come out of this pandemic stronger than ever. And we wish everyone a happy, healthy, safe rest of your week. Please reach out to the mayor's office with any questions about any of our policy changes that we're making. Again, our email is mayorsoffice@stanfordct.gov, and you can find more information on our website at stanfordct.gov. So with that, thank you everyone, and have a great rest of your evening.